Hello, and thanks for tuning into this presentation. My name is Michelle Fitzpatrick. I am the sexual rehabilitation nurse with the Prostate Cancer Supportive Care Program, and I will be providing this online presentation. Today, we will be discussing the recognition and management of treatment-related side effects of ADT. And throughout this presentation, we will be using the acronym ADT, which stands for Androgen Deprivation Therapy, also known as hormone therapy. A quick thank you to our funders. We are a grant and donation funded program, so we are very thankful for the continued support of our donors. Our program was initiated in Vancouver with funding from the Specialist Services Committee. Since then, we are very thankful to have received a grant from the Ministry of Health to expand provincially within BC cancer sites. We are really excited to have the ministry on board and in seeing the value of education systems or programs such as ours within the healthcare system. And here's some more information about the Prostate Cancer Supportive Care Program. We offer education sessions and clinical appointments for all 7 modules. Additionally, we conduct research studies within our program, and we collaborate with partners across North America. And here's a look at those 7 different education modules that we offer. They're all offered either in person or through live online programs. Most of these education sessions are offered every month and have a clinic. So if you are interested in learning more about our one-on-one appointments or our education sessions, please get in contact with your local program coordinator. Our contact information will be located on the last page of this presentation, and we'll make sure to get you signed up for the next time it's offered. Today's presentation will be providing a brief overview on prostate cancer, discussing how does androgen deprivation therapy work, what are the treatment options, and what are the side effects and how to manage them. This presentation will provide a lot of information and list many side effects for ADT. While this can feel very overwhelming, just know that not everyone has side effects from ADT, and most people do not experience all of them. We cover everything just in case someone is struggling with that specific side effect. So here's that overview on prostate cancer. Prostate cancer is a common disease. 1 in 9 men in Canada will be diagnosed with prostate cancer in their lifetime. It is the most commonly diagnosed cancer among Canadian men at 20% of all new male cases. It is also typically slow growing and, if caught early, very treatable. Fortunately, due to advances in screening and testing and treatment options, men are living longer with prostate cancer. And it's often the case that a man with prostate cancer is at a greater risk of death due to another disease process, such as heart disease. Now let's talk about androgen deprivation therapy and testosterone. Testosterone is the main sex hormone in the adult male, and it belongs to a family of hormones called androgens. It controls how the prostate grows and develops. Think of testosterone like the fuel source. If we take away the prostate cancer's fuel, it will no longer be able to grow. And ADT is that process where we stop testosterone from being made or used in the body. And this can be done either surgically or chemically. In the 1940s, Dr. Huggins discovered that by removing the testes, men with prostate cancer were living longer and had decreased pain from their disease. And that's what prompted the discovery of medical treatments, such as injections, that can lower the testosterone level as much as surgical removal of the testes. Now, testosterone is responsible for many functions in the body. It is critical for muscle development and preservation, as well as reducing body fat, bone strength and density, skin and hair growth. It's involved in your heart, liver, and kidney function, blood cell growth in the bone marrow. It affects your sex drive and penile health, as well as mood, energy, and cognition level. Now, the goal of ADT is to decrease testosterone as much as possible. And that's why there's the potential for so many side effects, because testosterone is involved in so many different parts of the body. Now, looking at options to control testosterone levels, there are several options to lower that testosterone. And the first option is a surgical procedure to remove the testes called an orchiectomy. And the second option is using a medication in the form of injections or pills to stop the production of testosterone or from using testosterone. So for injections, we have two types that can block the signal from the brain to the testes. One is called an LHRH agonist and another an LHRH antagonist. And you may be familiar with some of these names, such as Zoladex, Lupron, Firmagon. These are really common injections that are prescribed for androgen deprivation therapy. And then we also have anti-androgens, which stop the body from using testosterone. And these are usually taken in combination with an LHRH agonist, such as Zoladex, Lupron, Eligard, or Superfect. And we'll talk more about how these different treatment options work in the next few slides. So starting with the orchiectomy, the surgical procedure, this is done as a day surgery and typically takes 30 to 45 minutes. You will be put to sleep for this procedure, and it's a good option for those where intermittent hormone therapy is not recommended by their doctor, or for those who just desire permanent testosterone suppression. Now, all surgical procedures do have risks involved, so I do recommend talking to your doctor if this is an option you'd like to explore further, if you'd like more information about the orchiectomy. Now we'll look at the injections, starting with the LHRH antagonist, such as Firmagon. Now, this directly blocks the signal from the brain to the testes. With an immediate loss of communication from the brain, the testes stop producing testosterone. This lowering of the testosterone in the body is called castration, and it typically is achieved within about 3 to 4 days of that first injection for the antagonist. And then looking at the agonist, such as Lupron, Zoladex, or Eligard, these work by overstimulating an area of the brain, which is responsible for sending that signal to the testes. Now, this initial overstimulation causes an increased signal to the testes, which causes them to produce more testosterone initially. This is known as a testosterone flare. And after about 3 or 4 weeks of this constant overstimulation in the brain eventually says, I'm too overwhelmed, and it stops sending those signals to the testes. So this causes the testes to stop producing testosterone or causes castration. Now we also have at the bottom, you can see the first generation non-steroidal anti-androgens. These stop cancer cells from using testosterone. Your doctor may prescribe an anti-androgen if you are receiving an LHRH agonist to stop your body from responding to that testosterone flare. And the anti-androgen is usually taken 10 to 14 days before your first injection. They can also be used for a type of therapy called maximum androgen blockade, which is used for patients with typically more aggressive disease. Now let's take a look at how they compare. So starting with the orchiectomy again, this is a permanent procedure and causes permanent loss of testosterone in the body. The level of testosterone will drop very, very quickly within about 3 to 4 days. And then for medical castration, again, using medications to decrease the level of testosterone in the body. For LHRH agonist, the level of testosterone decreases within about 3 to 4 weeks, as it takes some time for the brain to become overstimulated and stop sending that signal to the testes. And there is that testosterone flare with the agonist, as there's that initial surge of testosterone before the brain is overstimulated. Now, your doctor will likely prescribe an anti-androgen to stop the body from using all that extra testosterone in the beginning. And the injections are typically given every 3 to 4 months. About 1% of individuals will have a local reaction, which is seen as some minor redness, swelling, or rash around the injection site. Now, looking at the antagonist, this decreases the level of testosterone in the body within about 3 to 4 days. So it's a little bit quicker than the agonist, as we're not waiting for the brain to be overstimulated. It's just that direct blocking effect. And there is no testosterone flare or usually no need for prior anti-androgens. About 40% of individuals will have that site reaction. Again, that's some swelling, redness, or rash at the injection site. So it is quite a bit more common for like Firmagon for that to happen. And these injections are typically given once a month. About 22% of individuals prefer the surgery and 78% prefer injections. So the injections are usually the more common treatment. For all the treatments, cardiovascular complications appear to be similar. And for looking at cost comparison, the surgery can cost hundreds of dollars, as it is a one-time procedure, whereas the injections can cost thousands, as some individuals will be on injections for a long time or for the rest of their life. Now, ADT can cause a number of side effects. And looking just at hormone treatment side effects, this can include weight gain, loss of muscle mass, gynecomastia, or gaining fat in the breast tissue, testicular atrophy or genital shrinkage, loss of body hair, hot flash, fatigue, lack of initiative, and sometimes mood disturbances. Now, we'll go over each of these side effects in detail in this presentation, and we'll talk more about how to manage them. One thing I want to point out is that most men who are being treated for prostate cancer have had some form of primary treatment before starting hormone therapy. Now, primary treatment options may include having radiation therapy or surgery. So for radiation, that might be brachytherapy or external beam radiotherapy. And for surgery, that's typically a prostatectomy or removal of the prostate. Now, some side effects from surgery or radiation may include having urinary incontinence, which is the leakage of urine, climacteria, or the leakage of urine with orgasm, altered or painful orgasm, or dry ejaculation. Now, when you are on both a primary therapy and hormone treatment, you are at a greater risk for developing further or worsening side effects. And when you're on combined therapy, some of these side effects may include erectile dysfunction, penile shortening, low or no libido or sex drive, depression, altered couple relationship, and partner distress. Now, these side effects may occur in either androgen deprivation therapy or primary therapy, yet they are more likely to cause problems if you are receiving both treatments. So now we'll take a look at those side effects of androgen deprivation therapy. And we'll start with what physicians will commonly tell you. They may tell you that you will have a loss of libido or sex drive, erectile dysfunction, or hot flashes. It's important to note that generally, the longer you are on ADT, the more effects you may see. Once ADT is stopped, your testosterone level in the body will usually begin to rise slowly and eventually may return to a normal level, though in some men it may not. Talk to your doctor if you want to keep track of your testosterone levels, as not all physicians will order it routinely. Now, looking at that first side effect, loss of lowering of libido or sex drive. When testosterone is lowered, your libido or sex drive may also decrease. About 90% of men on ADT experience a lowered sex drive, so it's one of the most common side effects. And unfortunately, there is no magic pill that can increase your sex drive. For some couples, this can be a very small change in their usual routine. And for others, this can be a major loss in their relationship. And it is age-related as well. Testosterone naturally decreases with age. So if you already have a lower testosterone level, you may not notice a change in your sex drive. Some things you can do to increase your sex drive include exercise, and you'll hear that a lot in our presentation as it is so beneficial for managing many side effects from hormone treatment. Building intimacy with your partner, having those feelings of closeness and connection. Practicing mindfulness, being aware of your thoughts and feelings in the present moment without judgment or criticism. Sensate focus and simmering are activities you can engage in to enhance your sexual desire and intimacy. And if you're suffering from a lowered libido and feel that it's affecting your sexual health or intimacy with your partner, I encourage you to enroll in our second module, which is managing the impact of prostate cancer treatments on sexual function and intimacy. Our program also offers one-on-one appointments with a sexual health clinician like myself, where you can discuss strategies for enhancing libido. Next, looking at erectile dysfunction. Erectile dysfunction is very common for men on hormone treatment. About 73 to 95% of men will experience some form of erectile dysfunction. Testosterone assists with nerves that cause erections. So if your testosterone level is low, then this can impact your ability to form and maintain an erection. Erectile dysfunction can also happen from a lowered sex drive or from stress, anxiety, or depression. There's lots of causes, as erections are a complex process. So there's many options out there to help with erectile dysfunction. You may be familiar with medications like Viagra or Cialis. There's also vacuum therapy or penile injection therapy. So if you're interested in exploring or learning more information about these options, I recommend talking to your sexual health clinician like myself or talking to your doctor. And just an important note that if you have a partner, you can include them in this process. The effects of prostate cancer treatment can affect your partner just as much as the person with cancer. So if you or your partner need counseling or support in any way, please reach out to us. And another thing is that a lot of individuals do not know that even if you are not able to form or maintain an erection, it's still possible to get pleasure and orgasm from sexual stimulation. So you don't need to have an erection to have an orgasm. So the nerves that are responsible for erection, these are different than the nerves that are responsible for orgasm and pleasure. So, if this is a concern for you, we have lots of information about how to enjoy sexual activity with a flaccid or softened penis. So, feel free to reach out to myself or another sexual health clinician if you're needing more information about that. Now, looking at another common side effect, which is hot flashes. These typically start after 2 months of starting hormone treatment. And the frequency and severity of hot flashes are individual. Some patients tell me that they last for a few seconds, and others, it can last for several minutes. So they do range from individual to individual. Some are not affected at all, and others are very much to the point where they will avoid going out in public or socializing. Now, the best way to manage hot flashes is through diet, controlling heat, and eliminating stress where possible. And for your diet, it's best to avoid any alcohol, spicy food, and caffeine. Now, what are some things that can help with your hot flashes? For non pharmacological interventions or things you can do without medications, this can include wearing sweat wicking material, follow an exercise program. Regular exercise can really help. Sleeping with light layers and using a fan, drinking lots of fluids and staying hydrated is important. And some individuals have said that massage, acupuncture, and cognitive behavioral therapy have helped. If you have hot flashes, I highly recommend keeping a hot flash diary. This is where you write down when your hot flashes happen, for how long they last, and what you were doing prior to the hot flash. Sometimes this can help you determine what is making the hot flashes worse and how to cope with them better. Now, continuing to look at hot flashes, here is a list of supplements or natural remedies that people sometimes try that can help manage hot flashes. Well, sometimes people say they've worked for them. Unfortunately, there is a lack of clinical evidence to prove that they are effective in treating hot flashes. I also want to caution you against trying any new supplements or herbal remedies. Many of these have side effects of their own or can interfere with certain medications. So always ask your doctor or talk to a dietitian before trying something new. Now, if non-pharmacological interventions are not enough to manage your hot flashes, you might want to talk to your doctor about using a medication. And there are some medications that are shown to decrease the severity of hot flashes, such as gabapentin or venlafaxine or Effexor are commonly used. But just be aware that many of these medications have their own side effects and as such are typically used as a last resort if all the other things aren't helping. Another note is that these medications typically take at least 4 weeks before they start working in the body. So you do have to stay on them for at least that amount of time to see if there is any benefit. So we've talked about what physicians commonly tell you, and now we'll discuss which side effects you may see in your body. That can include weight gain, gynecomastia or increased breast tissue, a loss of muscle mass or strength, shrinkage of the penis or testicles, and hair changes. Now, looking at weight gain, when your body undergoes a change in testosterone levels, it's common to gain weight and lose muscle. More than 40% of men are already overweight at the time of diagnosis, and that makes them more at risk for further weight changes. It's common to gain about 10 kilograms or up to 10 kilograms, which is 22 pounds, over a period of 6 to 9 months after starting treatment. Now, this is typically due to having an increased appetite or cravings for unhealthy foods. Weight gain is common in the waist, hips, and thighs, which can make it especially challenging to lose even when hormone treatment is stopped. So try to focus on the things you can influence, like eating a healthy diet and adding exercise into your daily routine. We offer a group education session with an exercise physiologist to help support you in your health goals. So please reach out to us if you're interested in learning more about how you can use exercise or nutrition to help manage your goals. And when testosterone is not available, the penile tissue doesn't work the way it used to, meaning less blood is flowing into the penis, causing the tissue to shrink over time. Genital shrinkage is very common. About 93% of men experience this. The maximum shrinkage is about 1 to 1.5 centimeters and typically stops 12 to 18 months after starting treatment. Now, the shrinkage of the testes is from the loss of activity in producing testosterone and sperm. If you are on hormone treatment short term, meaning less than 3 years, the size of your testicles may recover when your testosterone levels recover in the body. But the best thing you can do to prevent genital shrinkage is to continue stimulating blood flow into the penis. This can be done in a variety of ways, such as penile massage in the shower, self-stimulation or masturbation, or sexual activities with a partner. And again, if you're needing more information about penile rehabilitation, I recommend you come to our second education session where we spend a lot more time talking about that. And you may experience some hair changes. This is typically a thinning of hair on the trunk, arms, and legs, or sometimes it can be in the beard. But most of the time, it's typically not too bothersome, though it can be distressing if you're not informed of this side effect before starting treatment. Hair loss is typically reversible if you stop androgen deprivation therapy. So now we will take a look at some side effects that you won't see. These are more physiological changes, things that can happen inside the body. And that's why it's important to monitor you closely with your doctor while you are on hormone treatment. So some of these side effects can include having a loss of bone density, diabetes and cardiovascular disease, and metabolic syndrome. So starting with that loss of bone density or bone mineral density, BMD, is the amount of bone mineral in your bones. ADT causes a loss of BMD and can increase your risk for fractures. Many individuals have a low bone mineral density before starting treatment, and this loss of bone mineral density continues with time and can be further worsened by the loss of muscle mass and strength. If you are on hormone treatment for longer than a year, this is typically more of a concern, but ask your doctor about getting a bone density scan if you haven't had one, as this can help to assess your risk for getting a fracture. Now, some things you can do to prevent that loss of bone density All patients on hormone treatment need to ensure they are receiving adequate amounts of calcium and vitamin D. We recommend at least 1,200 milligrams of calcium and 1,000 international units of vitamin D per day. Now, some people are able to meet these requirements through diet alone. Others will need to take supplements. So we recommend meeting with your healthcare provider or with a dietitian to determine if you need that additional supplementation. And it's important to note that it's not good to take too much calcium, as this is not good for cardiovascular health. If you're at a moderate to high risk of fracture, talk to your doctor about starting a medication called Prolia. This can help with your bone health. And another thing you can do is engage in resistance and high impact exercises. These are proven to preserve your bone mineral density. And you can talk to our exercise physiologist if you need more information about how to do those resistance exercises. And here's a look at the bone mineral density test, which shows bone health and your risk for breaking bones. Some pictures that show bone density loss on the left-hand side. The top picture shows a normal bone on a bone density scan. You can see the bone is strong as the cortical outer shell is thick and the fibers are thick and interconnected. The middle picture shows bone that is starting to lose some density. And the bottom picture, the bones are very fragile and at risk of breaking easily. On the right-hand side, we have information about the bone density DEXA scan. This is where your bone density test results are reported using a T-score. And a T-score shows how much your bone density is, higher or lower than the bone density of a healthy 30-year-old adult. So normal would be ranging from -1 to 4. Low bone density or osteopenia would be from -2.5 to -1. And osteoporosis, where porous bone can lead to fractures, is -4 to -2.5. Diabetes and cardiovascular disease during ADT. This is a chart from an observational study comparing diabetes and cardiovascular disease in patients who had no hormone treatment, as shown in the blue, and patients who did receive hormone treatment, as shown in the gray. So as you can see, comparing the blue with the gray, individuals on hormone treatment are at an increased risk for diabetes, coronary heart disease, heart attack, and sudden death. So those who already have cardiovascular disease before starting hormone treatment are at an increased risk for cardiovascular events, which is why it's important for you to follow up with your doctor regularly to make sure everything is working well. Metabolic syndrome is a condition where you have 3 of the 5 listed conditions on the right-hand side. And the risk for developing metabolic syndrome while on hormone treatment is 55%. So looking at those 5 conditions, visceral obesity, that's fat stored around the abdomen, insulin resistance, also referred to being pre-diabetic. Your insulin levels may increase up to 18%. So you may develop diabetes after starting hormone treatment, or diabetics may notice their sugars increasing. Hypertension or high blood pressure, triglycerides, this is a type of fat found in your blood, and HDL cholesterol is the good type of cholesterol, so having low amounts of the good type of cholesterol. And if you develop metabolic syndrome, this can be a problem as that puts you at an increased risk for heart attack or stroke. So talk to your doctor if you think you have any of these conditions. And we like to follow the ABCDE approach for preventing metabolic syndrome. A is having awareness and possibly taking a low dose of aspirin. So awareness, talk to your doctor about metabolic syndrome and ask them to monitor you closely while you're on hormone treatment for this condition. Some patients may need to take a low dose of aspirin once a day. This isn't recommended for everyone though, so talk to your doctor first before starting this. Blood pressure, do a baseline blood pressure every year and while on hormone treatment. Cholesterol and cigarette use, ask your doctor to check your cholesterol levels. This is done during a blood test. And we recommend decrease or eliminating cigarette use, and we can help refer you to the Quit Now program if needed. Diet and diabetes, follow a healthy diet and monitor your weight. And you can ask your doctor to check your blood sugar levels during your check-ins. And exercise, again, as you've seen, it's beneficial for preventing many conditions and managing many side effects of hormone treatment. We recommend minimum 150 minutes per week of moderate to vigorous activity, and additionally, 2 to 3 resistance training sessions. And finally, we'll look at side effects of hormone treatment that you may feel. This can be muscle and joint aches and pains, depression, feeling flat or not enthusiastic, and having emotional lability or having mood swings or changes. Cognitive dysfunction, sometimes that can happen, and then fatigue or lack of energy, lack of initiative. So starting with those muscle and joint aches and pains, typically starting within about 3 months of treatment. The cause of this side effect is not 100% understood, yet it could be due to muscle wasting and tendons or ligaments thinning. So for non-pharmacological or non-medicinal interventions, activity and resistance exercise are best. Some people have told me that acupuncture has helped them as well. For medications, if your doctor says it's okay, you can take Advil or Tylenol to relieve minor aches and pains, but just make sure you're always reading the back of the bottle, not taking more than what's recommended. And then if these interventions are not enough to manage your pain, talk to your doctor about a medication called Cymbalta, as sometimes that can help too. And then looking at depression, it's important to acknowledge that depression can occur while on hormone treatment because of hormone changes, especially if you have a prior history of depression. Generally, the longer you are on hormone treatment, the higher risk you have of developing depression. It's seen in about 13% of men on hormone treatment, and the risk is 8 times higher than the general male population. Some things you can do are exercise, can help increase your mood and improve symptoms of depression. Sometimes medications can help. If you feel like you need an antidepressant, talk to your family doctor. And we also provide counseling services to help cope with symptoms of depression or other mental health changes. So let us know if this is something you or your partner are interested in. For cognitive function, there is mixed evidence on the effects of hormone treatment on cognitive function. Some people notice changes in their memory. This is typically seen as changes in spatial memory, like where did I put my keys or where did I park the car? Some things that can help can be counseling services, including cognitive behavioral therapy, improving organization and reducing clutter. Reducing alcohol intake and smoking can improve your cognitive function. And again, we always recommend lots of exercise. And fatigue is common while on hormone treatment. It's seen in about 33 to 40% of men. It's a feeling of weariness, tiredness, or lack of energy that does not always improve with rest. And it can be considered one of the worst side effects of hormone treatment, as it can be so challenging to manage. Studies have shown that patients who exercise have less fatigue and mental health problems. So, another benefit of exercise. Um, and then fatigue can be caused by multiple factors, including stress, medications. If you're on a primary therapy like radiation, that can also cause fatigue. So, kind of looking at those other factors can sometimes help too. So again, here's our recommendation for exercise to help improve fatigue and other symptoms. And all of this information is provided in our exercise education session. So I highly recommend coming to this one if you need more information. And so make sure that your heart rate is in the target zone, moderate intensity or vigorous intensity, 50 to 70% or 70 to 85% of the time. And when we talk about moderate to vigorous activity, this is where you can still have short conversations, somewhat comfortable, yet becoming more challenging, to where perhaps you can speak a sentence, but you're feeling short of breath and borderline uncomfortable. That's where the 150 minutes should be. And then here are some other benefits of exercise. It just demonstrates that it really does help with all aspects of life. Some points we haven't talked about today is it can help with feeling more relaxed, being more social, lengthens attention span. Lots of benefits for exercise. And here are some take-home messages. Cancer and treatment can affect multiple areas of your life, including physical, social, sexual, psychological, and spiritual. It's important to look at each domain to ensure you are optimizing your well-being. As you've seen, hormone treatment can have many side effects, which can also be shown to be effective, but up to 20% of men do not have any side effects. Being proactive is the best way to avoid long-term problems with hormone treatment. So starting to do exercise and physical activity, healthy nutrition right away can help with some of those side effects. And then the Prostate Cancer Supportive Care Program. We're here to help you, but you do need to take the reins and be an active participant in your own health. And just to note that we list all these side effects, not to overwhelm you, but so that you are ready for them if they do happen. But again, it doesn't mean you will have all of them. Here's some information about our ADT clinic. If you need more information or would like to have a personalized discussion with a healthcare provider, you can book a one-on-one appointment with our ADT nurse practitioner. These appointments are currently offered via phone call or Zoom. So if you have a device with a webcam. So if you'd like to book an appointment, you can call this number or get in contact with your local program coordinator. And here's that information about our local coordinators located in Vancouver, Prince George, Victoria, and Kelowna. So thank you for attending this presentation today. If you have any questions, feel free to email your local team and we will get back to you shortly. I hope this presentation provided some information to help guide you in your prostate cancer journey. So thanks everyone. I hope you have a great day.